Welcome to Civic Education for JSS 3. Today we study social rights, specifically the rights to education and health in Nigeria. What are social rights? Social rights are rights that ensure people can participate fully in society and have access to the basic needs and services that enable a dignified life. They include the right to education, health, housing, social security, and adequate standard of living. Social rights are part of human rights and are protected by both Nigerian law and international conventions. The right to education in Nigeria. The right to education means that every person has the right to access quality education. Constitutional provision, Section 18 of the 1999 Constitution, Chapter 2 Government shall provide free, compulsory, and universal primary education. Government shall provide free secondary education. Government shall provide free university education. Government shall provide free adult literacy programs. Remember, these are in Chapter 2 and are not directly enforceable in court. However, the Universal Basic Education (UBE) 2004 makes 9 years of basic education compulsory and free by law. This is enforceable. The UBE covers primary 1 to 6 and JSS 1 to 3. The Universal Basic Education Commission (BECE) administers federal support for UBE. International Framework, UN Convention on the Rights of the Child, CRC. Every child has the right to free and compulsory primary education. SSCE, right to education, free primary, progressively free secondary and higher. Challenges to the right to education in Nigeria. Out-of school children. Nigeria has one of the highest numbers of out-of-school children in the world, estimated at over 10 million. Poverty. Many families cannot afford school fees, uniforms, books. Insecurity. In the Northeast, Boko Haram, whose name means Western education is forbidden, has attacked schools and students. Gender discrimination. In some communities, girls are not sent to school. Poor quality. Many schools lack teachers, furniture, and learning materials. Child labor. Children working to support their families instead of attending school. The right to health in Nigeria. The right to health means everyone has the right to the highest attainable standard of physical and mental health. Constitutional provision, Section 17, 3d, of the 1999 Constitution, health, safety, and welfare of all persons in employment shall be secured. Section 16, 2d. The state shall protect the right of every citizen to enjoy the best attainable standard of living. The National Health Act 2014 is the primary legislation governing healthcare in Nigeria. It establishes the national health system and guarantees a basic minimum package of health services for every Nigerian citizen. International Framework, SSCE Article 12, the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. This includes reduction of infant mortality, healthy development of children, prevention, treatment, and control of epidemic diseases, creation of conditions to assure medical service and attention to all in case of illness. Challenges to healthcare in Nigeria. Underfunding. Nigeria spends only about 4% of GDP on healthcare, below the Abuja Declaration target of 15%. Poor infrastructure. Many hospitals and clinics lack equipment, drugs, and electricity. Brain drain. Nigerian doctors and nurses are emigrating, especially to the UK, USA, Canada, leaving fewer healthcare workers at home. Rural access. Healthcare facilities are concentrated in cities. Rural Nigerians have very limited access. Maternal and child mortality. Nigeria has very high rates of maternal and child deaths compared to global standards. Disease burden. Malaria, HIV, AIDS, TB, and cholera remain major public health challenges. Government programs to promote social rights. Education. Universal Basic Education (UBE), free compulsory education. School feeding program. Homegrown school feeding program, providing free meals to pupils in public primary schools. Health. National Health Insurance Scheme (NHIS), a scheme to make healthcare affordable through insurance contributions. Midwife Service Scheme (MSS), to reduce maternal and child mortality in rural areas. Immunization programs, polio vaccination, Nigeria declared polio-free in 2020. Conditional cash transfers, government cash payments to the poorest households through the National Social Safety Nets program. Remember, social rights equals rights ensuring people can participate fully in society plus have access to basic needs plus services enabling a dignified life, include right to education plus health plus housing plus social security plus adequate standard of living, part of human rights plus protected by Nigerian law plus international conventions. Right to education, Section 18 of 1999 Constitution Chapter 2, Government shall provide free plus compulsory plus universal primary education plus free secondary education plus free university education plus free adult literacy programs. Chapter 2 equals not directly enforceable in court, Universal Basic Education /UBACT 2004. Makes 9 years of basic education compulsory plus free by law, IS enforceable, covers primary 1-6 plus JSS 1-3, UBECE equals Universal Basic Education Commission administers federal support, international framework, CRC equals every child has right to free plus compulsory primary education, ISSA equals right to education equals free primary, progressively free secondary plus higher, challenges, higher to F school children, Nigeria has one of highest numbers in world equals estimated over 10 million. Plus poverty, families cannot afford school fees plus uniforms plus books. Plus insecurity, Boko Haram equals Western education is forbidden attack schools plus students in Northeast. Plus gender discrimination, in some communities girls not sent to school. Plus poor quality, many schools lack teachers plus furniture plus learning materials. Plus child labor, children working instead of attending school. Right to health, highest attainable standard of physical plus mental health, Section 17, 3d, equals health plus safety plus welfare of all persons in employment shall be secured, National Health Act 2014, primary legislation governing healthcare in Nigeria, establishes national health system plus guarantees basic minimum package of health services for every Nigerian citizen. International framework, ISSCE Article 12 equals right of everyone to highest attainable standard of physical plus mental health, includes reduction of infant mortality plus healthy development of children plus prevention plus treatment plus control of epidemic diseases plus creation of conditions to assure medical service plus attention to all in case of illness, challenges, underfunding, Nigeria spends only about 4% of GDP on healthcare equals below Abuja Declaration target of 15%. Plus poor infrastructure, many hospitals plus clinics lack equipment plus drugs plus electricity. Plus brain drain, Nigerian doctors plus nurses emigrating especially to UK plus USA plus Canada, fewer healthcare workers at home. Plus rural access, healthcare facilities concentrated in cities, rural Nigerians have very limited access. Plus maternal plus child mortality, Nigeria has very high rates compared to global standards. Plus disease burden, malaria plus HIV, AIDS plus TB plus cholera remain major public health challenges. Government programs, education equals UB, free compulsory education. Plus school feeding program, homegrown school feeding equals free meals to pupils in public primary schools, health equals national health insurance scheme /NHIS, make healthcare affordable through insurance contributions. Plus midwife service scheme /MSS, reduce maternal plus child mortality in rural areas. Plus immunization programs, polio vaccination, Nigeria declared polio-free 2020. Plus conditional cash transfers, National Social Safety Nets program equals government cash payments to poorest households. Thank you for studying civic education with us today.